So, Dr. Ewing, welcome, SAGES 2025.
Thanks, it's great to be here. Awesome booth.
Yeah, we're here in Long Beach, and my understanding is you've been working on AI in Scribe. So you helped build MedScribe for us, so MedQuil, Search on Scribe, and you've been working on this project for years now. Could you walk us through what was the idea, where did it come from, and where do you see this going in the future?
Yeah, it came from a bad day of call. It's what it did. I was overwhelmed with charts, with consult notes, H&Ps, all the stuff that bogs us down. We love operating, we love, making medical decisions on patients, but we hate all the other stuff, and it's only gotten worse. The coding requirements they put on us, they send charts back when they query what level of diabetes it was. I'm like, I'm a surgeon, I just want to do surgery and do it well. And so my brother-in-law is actually a developer that had said that there's these programs that he's like, oh yeah, I could build something that did that. And, we're just sitting around the fireplace having some whiskey talking about how miserable my job was. He's like, I bet AI could do that. And I was like, nah, I'm a doctor. I need, I'm better at it. Turns out not true. So like a week later, he's just, he had a bunch of Mountain Dew and ordered a bunch of pizza and stayed up late a bunch of nights and gave me this kind of demo app. And it was just, back then it was just a little web app that you actually had to log into a website, and it was kind of, you had to tinker with it sort of thing. But its outputs still saved me time. The really bad user interface system, even with that, I was like, this is amazing. I could just sit in the room, listen to the patient, kind of all the stuff that fills my mind of things I need to talk about or remember when I walk out of the room were just caught by this app. And so I said, hey, we need to do this. People need this. I became dependent on it, just the web app, within about a week. I just couldn't do clinic without it. And so after that, it became an app. We partnered with y'all, have excellent success, and we're just telling people about it because really surgeons don't understand what AI does. We don't know. I didn't know until Jared educated me, and I saw what it can do. It's unbelievable. And so it really it's like magic to us. It just makes a whole note and listens in the ambient room, and you can talk to it like a scribe, you can talk to it like your nurse, you can talk patient-to-patient interaction, and it understands everything and creates a perfect note and codes for you. So that's where we're at. Where we're going is pretty cool places. The app that we have on there does templates. We're going to start to move into the operative arena, which is going to be excellent. So when surgeons are used, you kind of have to introduce things to people when you're changing their workflows. You have to introduce them slowly, or else it's like too much newness and they don't know what to do with it. So we like to add a feature at a time, watch people adopt it, and kind of figure it out. And that's what we've been doing. So we have a lot of good stuff coming with operative reports, billing, kind of predicting how much you're going to bring the hospital with your H&Ps, consult notes, and operative dictations, and really just making sure we don't forget something in a dictation. So that's where it's headed. It's going to be making our jobs way easier. The people who don't use AI are going to be falling behind.
We do know that all of this has been working very well for you, and it's HIPAA compliant, and of course it's built by surgeons.
Yep.
What do you think is the key discussion point, or the thing that you really want to get out to the surgeon community about why they should be really taking this up?
Really, it's about bandwidth. We're all struggling with bandwidth over here at SAGES. We got hundreds of surgeons, thousands that are it's like our break, and we're still doing something. We just say yes to everything. We're on committees. We deal with patients. We have businesses to run. We have a lot of stuff going on. This is one of those things that you need in clinic to lower the stress of your job and make you better at your job. And it takes a little bit of, everyone kind of is like, AI, that sounds cool. I'll use it when it makes sense for me. No, the time is actually right now. It is that good. It will save you time no matter what EMR you use, and your life will get better. You just have to put 10 minutes into it and try to figure it out. And once you see how it works, it's mind-blowing. The time is actually now to start this stuff, not figure it out 4 years later when you could have seen 300 more patients last year and retired a year earlier. Because it really, I've added 7 patients per clinic, and I do 2 clinics a week. That's 14 more clinic patients that over this last year has been incredible to my production. So yeah, the stuff matters, and so I recommend people try it.
Yeah, we've been very excited to pair with you guys and to work with you. And this partnership has been great because I think that from a surgeon standpoint, we're very busy, as you've already said. Even if we're interested in trying an AI technology, figuring out which ones we can trust, which ones are HIPAA compliant. You always have to worry about the medical legal aspects of it because obviously it's this patient data that we're dealing with. It's a situation that I wouldn't necessarily take the time it would require to go through and find an app and then have to go through the trial of it and make sure it works and everything else. Whereas what we've done is we said, look, we trust you, you understand, and your team understands what we're trying to accomplish. As a surgeon, this is definitely your ballpark. And you've built this around the needs of other surgeons, other doctors. So it really allowed us to vet it pretty quickly. We've, from our standpoint, we're able to say this is legit, it's definitely HIPAA compliant, it follows all the rules we need, and we know that it's built for the people that we're really trying to serve. And that's always going to be kind of the position that you take.
Yeah.
Right?
Absolutely.
So if they wanted, let's say surgeon or a medical professional, it works for psychiatry, we have a psychiatrist playing with it.
Yeah.
It's worked for other specialties, so it's not just surgeons.
Yeah.
But that being said, if they wanted to try it, how would they go about doing that?
Yeah, just go to the Surgeon app, click on the feather, it brings you right to it. There's 30 patients are totally free. You don't even have to put your credit card information in. It's like easy. My 4-year-old could probably figure out a way to run a first patient on and get a account. It's very easy and very protected. So just give it a shot. Try it at home with your wife and kids. Mess around with it. It will impress you.
Yeah, well, I agree. I played with it. I thought it was amazing. Of course, we've been using it now, and it's definitely been a game changer. So thank you so much for everything you've done. And once again, welcome to Cutting Edge, and I hope you enjoy the rest of your time here in Sages.
Thanks for having me.
Pleasure.
All mine.
Time spent charting is time away from patient care. That's why we created Surgeon Scribe. With one click, generate complete soap notes and save 6 minutes per patient. That can add up to saving 2 hours every day. No more late nights documenting. With a simple setup and customizable templates, you're ready to go in minutes. Start your free trial today and transform your workflow. Surgeon Scribe, because your time matters.
What changed for the resident who traded the standard route for new destinations? For the physician who stopped breaking dates and started making plans? For the seasoned pro who didn't retire from their passion, but instead rekindled it? Turns out for each of them and each of you, the difference is a story, a locum story. Find a locum story that speaks to you at locumstory.com.
Dr. Fletcher, welcome so much to the Cutting Edge. We're here at Sages 2025, of course, Long Beach. Pleasure to meet you. I'm really excited about this. You're general surgeon, long-term general surgeon. You've been in practice for almost 30 years, but you've transitioned your practice now. So you went from working in the standard day-to-day hospital private practice, and now you're moving into more of the locums world. And there's a much different perspective than I think I really expected to hear. Can you kind of walk us through your history?
Yeah, well, I finished in general surgery in 1995. I was in a real busy urban metro practice for the first 10 years. I worked at 4 hospitals and 2 outpatient centers and did 600 or 700 operations a year. And I got really good experience. I was busy like pretty much everybody in that time frame. Then I moved back to my native California, and I spent about 17 years working in a critical access hospital in rural Northern California. And that was quite a bit different, but my broad background helped there. And then a couple of years ago, I went through, I think what a lot of us do after 20 or 30 years, I've been in practice 29 years, just working a lot and tired of it. I wanted a break. My wife decided I needed a break, which was good.
Then you decided to go to locums. What was the deciding factor, and how did you get through that surgeon mentality of not having day-to-day constant work that just kind of drives you?
Oh, that's hard to I think most of you've probably done the same thing where you go on a vacation and for a few days you're just trying to relax and not think about call or some sick person in the ICU or whatever you're
Oh, absolutely.
however you're focused. And then maybe by the time you relax, for me it was a week or 10 days into a 2-week vacation, you're done.
Yeah.
And then it's time to go back to work. That was a tough transition. It's a tough transition for anybody, whether you're working locums or not. But the way I see locums is maybe that is a good transition for the full-time running the treadmill surgeon that's working 60 or 70 hours a week like I did for decades, to step off the busy merry-go-round and then just be the consummate professional. You go into a hospital where you don't know anybody, they don't know what your card is, your preference card, your favorite brand name tools. If you really have to have Coke instead of Pepsi, or all your tools have to be lined up, then it's probably not for you. You have to be flexible on what tools they're going to have, what help you're going to have. If you need 5 people to hold your hand to do every operation, then to me you're not really a general surgeon. You're spoiled, or you need 5 people to hold your hand.
Yeah.
So you kind of can't do that. The time off at first was hard. Yeah.
It's so funny to hear you say that, because it was something that I've realized only relatively recently, because of this job now, and I'm still doing clinical practice, but I've had to back off, and to have even an hour or two of free time in a day that I'm used to just being booked solid, I feel lazy. And it's like, how can I be working 60 hours, 70 hours a week and feel like I'm lazy about it? But I can't tell if I assume it's a mixture of personality types that get you into the field, mixed with the field itself and what it does to you over the course of years and decades of just working you into this belief system that you have to always be doing something.
I think you and I have probably, maybe all the listeners or viewers, I've seen surgeons that don't retire or age gracefully. Yeah. They get old or croaky, or they're still doing something that the way they did it years ago. Yeah. And everybody kind of knows that they're good, they put in their time, everybody loves them, but they're just not good anymore. And I don't want to be that.
Oh, no, I get it.
Yeah,
and
I really don't want to be that.
And there's no alarm that goes off and goes, oh, no, you're that guy. Like, you have to recognize that. I think it's hard to recognize because it's just part of your life. Like, a lot of us, our identity's wrapped up in being a surgeon, and I think that's what you are. But you've made that transition. So what does it look like to go from working all the time in either private practice or in a hospital setting, and then to switch over to more locums? How do you make that transition? Who do you contact? What does that look like?
Well, it can be frustrating, first of all, or last of all, to not work as much as you'd like to. You'd like to be able to just turn on the spigot and work as much as you want. And it's real competitive. There's a lot of doctors in the younger generation now that are, that's the only way they work, is locums or part-time, or they're on a schedule to do, whether it's every hospital, especially ENT, ortho, general surgery, cardiology, GI, they're all, they can all be staffed by somebody that doesn't take their mail in that zip code where that hospital is. That's the way a lot of places work now.
I was interested and surprised because you were saying just how hyper competitive this really is. I mean, I think a lot of the surgeons, especially under the current model, what they're used to, wouldn't realize just how many modern day surgeons are going into this as a full-time practice, basically.
Yeah, it just really wasn't there when I went into surgical practice in 1995. But now, as I told you just briefly earlier, I met a couple doctors in Washington State. They were both young general surgeons. One was 1 year out, one 3 years out. Both of them told me they'll never work more than 10 days a month in their life. This is what they're going to do: is shift work, emergency general surgery only, work on the clinic when they need to or whatever. And that's sure different. Yeah. For me, I mean, that kind of work, that's kind of what I'd like to work toward, is a long-term or repeating relationship. The recruiters for locums call that a repeater, where a hospital needs a general surgeon that can do anything, or a broadly trained, let's say, general surgeon, to work 10 days a month. And then maybe you go back 10 days a month, and I think 7 or 10 days a month would be ideal for me at the stage I'm in, still allowing me to be a full-time dad.
I think locum is definitely a necessity, and I think that we're seeing it, as you said, used more and more. In my hospital, we need it for coverage regularly because there's not a lot of us out there, and it's hard to recruit. I mean, it's hard to get surgeons to go out to the small communities or out into the rural areas. And
I'll do it. I like doing it.
Exactly.
I don't know.
But I can't say how much I appreciate your time. I'm glad you're able to join us at the cutting edge. I hope you're enjoying Sages, and I look forward to talking to you again.
Yeah.
Thank you.
I appreciate it.
Time spent charting is time away from patient care. That's why we created Surge on Scribe. With one click, generate complete soap notes and save 6 minutes per patient. That can add up to saving 2 hours every day. No more late nights documenting. With a simple setup and customizable templates, you're ready to go in minutes. Start your free trial today and transform your workflow. Surge on Scribe, because your time matters.
Imagine a platform that connects you directly to a private group of surgical colleagues. Within the app, you interact socially with colleagues, post your own surgical videos, scan the library for relevant content by type of surgical procedure, anatomy, or even specific operative step. You'll be invited to live webinars and build your network through conferences hosted on the app, all while maintaining your privacy. Surge On, where surgeons go to explore, discover, and learn.
Welcome, Dr. Rashidi. How you doing? Welcome to the Cutting Edge here at SAGES 2025, of course, in Long Beach. It's a little overcast today. But we'd like to discuss your role here at SAGES. Obviously, you're one of the most famous modern colorectal surgeons. I think pretty much every conference I go to, you're there. You're giving lectures on some of the most advanced colorectal procedures that are out there currently. And today you're discussing emergency surgery, emergency colon surgery and the robot. Is that kind of where we're at?
So we had a session actually yesterday on emergent colorectal surgery, yes, in minimally invasive fashion.
And what's the highlights of this?
Well, the highlight is, what emergency surgery was known for, open, right? You get an emergency case and then bring it and do an open operation. But one of the things I like about SAGES is very, forthcoming and very open to innovation and advancement. And the way now we're approaching emergency cases are, minimal invasive, robotic, laparoscopic. It's not like the old way how it was open. So yesterday we had a great session, packed room, which was great, talking about different scenario of emergency surgery in colorectal and how you approach it in a minimal invasive fashion.
And from your perspective, what would you say is the most advantageous way to utilize minimally invasive surgery in the emergency setting?
Well, I think, you as a surgeon, you have to make that decision. You have to know your skills. You have to see patient condition. And if it allows, then absolutely you want to give that patient a chance to do it in a minimal. If you can get in safely and if you can see, you can do that case in a minimal invasive fashion. So I always say, it depends to the situation, how the patient is doing and what your skills as a surgeon is. And that's why we're doing all these, sessions, because we know it's possible, but you have to go through certain, learning curve and pathway to be able to do that.
As you talk about the learning curve, what does that look like? If you were going to teach let's say a young surgeon coming out of fellowship or residency, and you said, look, I think the right answer is to be doing minimally invasive surgery, for almost any emergency case that you possibly can, but you don't want to necessarily start there. So where would you see that pathway forming, and what would you recommend as a good starting point for them?
I would say, when you start, especially, and I was a fellow, came out, and when you start, you want to get your hands on. So you want to get that repetition and practice. So start with simpler cases. It doesn't have to be a super complex case. Any case you get, even if you do portion of it, in a minimal invasive fashion, you get that hands on. You get that repetition, and it builds up. You start with simpler cases, then you go to complex cases, then you go to the urgent emergent cases. So it's a stepwise approach. I won't say dive in from zero, but absolutely, you want to get that repetition.
Now, obviously, your skills are very advanced, but if we take that away, we say, what would be something that even you might hesitate to take on in a minimally invasive fashion if you had to do it emergently?
I mean, you want to be safe, right? Let's just, let me make sure that's clear. But I would say if I can see I can get in and see with a camera, I will tackle it minimally invasively. So, I mean, just a couple weeks ago, I think we're showing the video here, we tackled a patient that came to us, had 12 operations in the past with pretty much loss of domain. But I was able to get to the most lateral part and see, it wasn't an easy case, but we were able to see, put ports in, and it's just doing an open operation, but in a minimal invasive fashion. So yeah. You got to be safe, though.
So here we are at SAGES, obviously, and you're intimate partner with them. I mean, you're here every year, obviously, with doing multiple lectures. What do you see the advantage of SAGES as a society versus some of the other societies that are out there?
I think it's one of the most forward-thinking societies. I think it's one of the societies that pushes the limits, you know, from innovation to advancement in surgical care. And people are also very forward-thinking. They're collaborative, and I think that it's a great meeting with great, you know, surgeons and environment, and a true collaboration between, you know, the industry and, you know, pretty much the surgeons, which I think that's what's going to help to drive, you know, patient care and healthcare.
And why do you think SAGES have been able to pull that off, and some of the other societies may not have been so able to stay on the cutting edge of what's going on?
I think they listen to the surgeons from a higher up level. So, and surgeons, we all thrive for, we're all thirsty for what's next. How can we get better? How can we advance? And that's the reality. I mean, look where we are. And I think, you know, in a few years when you look at it, we're like, wow, you know, where are we going? So I think the communication is very strong at SAGES. And that's what's moving it, you know, forward very fast.
And how does somebody, if you're new into the field or you've been doing it for a while, you want to actually get involved in a society such as SAGES, what would you say is the best avenue to get involved and to start become part of this?
Yeah, you know, sign up, become a SAGES member. That's very important. You know, be involved, get to the committees you're interested, you know, have a voice, make a difference. So, but start by, you know, just signing up for SAGES.
Is that how you started?
That's how I actually started when I was a resident.
Really?
And I love it.
So can you give me one story about your career, that moment where you went from the knowledge, the textbook knowledge, to really gaining some wisdom, that key point that you've learned, you say, this is where experience really taught me something. Do you have that moment?
From SAGES, you mean?
Oh, just in general, just from the great Dr. Rashidi. What is that moment that you say, I really learned something I wouldn't have known from the textbook, but purely from
oh yeah,
training?
I think, I mean, just an example, because we are at SAGES, I remember I was a resident, and you know, as a resident in your program, you see things certain ways, so you really don't have that much, you know, knowledge or idea outside. And I went to one of the colorectal sessions, I remember, and that time robotic wasn't like a huge, I mean, it wasn't that, you know, prominent. So, but I saw the things that was able to be done, and I told myself, why, you know, why are we doing things just a certain way? There is no box, you know, for surgery. And, you know, one of the speakers was doing these things like completely outside of the box. And you know, that's where I told myself as a surgeon, you know, you want to be safe, but what, always question yourself, why do I have to do it this way? Why not this way? Even if it's not in the textbook. So that's, you know, I think what, how we can push, you know, surgery and healthcare to a next level.
Obviously that's true, but with that, you have to have a certain willingness to take some risk. I don't think every surgeon is necessarily going to be willing to do it.
Yeah, you have to take the risk, yes.
And you're definitely on that innovation side of the curve, which is what makes you so famous. So.
Oh, well, I don't know about that, but thank you.
Well, Dr. Rashidi, absolute pleasure to have you here this morning.
Thank you.
Once again, I hope you enjoy the rest of your time here at SAGES in Long Beach.
Yes.
And thanks for coming on the Cutting Edge.
Thank you. All right.